explain how to do skin fold measurements today. So when you're doing skin fold measurements, you want to measure 7 different sites. Some of the sites you want to measure are the chest, which is right here. It is a diagonal measurement, so you want to grab the skin and then measure about an inch away, half an inch away from your fingers. Next is your abdominal, or the abdomen, which is a horizontal measurement. And then we have our suprailiac, and it is also a diagonal measurement as the chest is. And then finally there is the thigh, which is a vertical measurement. If, after all you've done that, you want to turn your participant to the side and have them raise their arm gently. You want to do a mid-axillary measurement, which is horizontal and is right here. And then you'll have them turn to the back, and you'll do a vertical measurement on the triceps and a diagonal measurement on the subscapular region. All right, when you're doing a skin fold measurement on the triceps, you want to have the person's arm bent at a 90-degree angle at the elbow. You want them to relax so that the muscle back here will be just a little bit tense, but still you can grab the skin. You want to measure a vertical fold with your thumb and index finger pointed towards the feet, and you want it about halfway between their shoulder and their elbow. You always want to hold for 4 seconds when you're measuring after you've released your fingers. You always want to do it on the right side of their body, and you always want to measure twice at every site. And this is what it should look like. Alrighty. Alright, whenever you're doing a suprailiac measurement, you want to make sure it's a diagonal measurement at the fold of the crest of the ilium at the spot where the mid-axillary line would meet up with it. You always want to follow the crest of the person's hip bone, and you want to make sure that your measurement is half an inch from your fingers. You always want to hold your measurement for 4 seconds and be on the right side of the person's body. You will also want to measure twice at each area and always be at eye level with your calipers. If it's done correctly, it should look something like this. Alrighty. Alright, the third and final measurement that I'm going to show you today is going to be the mid-axillary measurement. So this was a little hard to do, so you want to get the person's arm out of the way. What I like to do is I'm going to take their arm and place their hand next to their neck. It gives you a clean line and it gets it out of the way. Next, you want to be down where you're measuring, eye level with your calipers always. And then you'll want to find where the xiphoid joint or bone on the sternum meets on the side, okay? Or if the bottom of the sternum, if that's easier to find for you. So after you've found your position, you're going to take your calipers and you're going to use pinch slightly and hold for 4 seconds. After that 4 seconds, you're going to always want to measure twice, so you'll want to do it again. And like I said, always be at eye level with your measurement. And again, on the right side of the body.